Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Roark. Guys, I am here with veterinary dermatologist and good friend, Dr. Ashley Bourgeois. Ashley is on the podcast today. Guys, we are talking about our top tools for cats when it comes to dermatology cases. Guys, I don't think cats get enough love when we do allergy and derm workups, honestly. And so I want to talk about that with Ashley, and we dive right into it, gang. Let's help some itchy cats by getting into it.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Roark.
Welcome to the podcast, Dr. Ashley Bourgeois. How are you, my friend?
Dr. Andy Roark, I am so good. Very excited to be back on the podcast.
It's great to have you here. For those who don't know you, you are a longtime friend of mine. You are a veterinary dermatologist. You lecture all over the world on veterinary dermatology. You are at the Animal Dermatology Clinic in Portland, Oregon. You've been on the podcast many, many times. You've got articles. You just do a ton of stuff, Ashley. I wanted to ask you about something today, and you're always so gracious with your time. You know, it's summer as we're recording this, and I'm in the South, and so summer means allergies and lots of ear infections and itchy skin and things like that. And so I was wondering if you would be up for talking with me a bit about the tools in our toolbox for dealing with dermatology problems in cats. I feel like derm in cats does not get a whole lot of spotlight, and I always like to kind of run back through the toolbox and make sure that I know what I can do and make sure that I'm aware of all my options in trying to help out our cats, because I don't know that they get as much care in dermatology as they probably should. So let me just pause there and start with that. Do you agree with that? Do you think that cats are underrepresented in our dermatology caseload, or do you think that they're just less likely to manifest problems?
I totally think they're underrepresented, and I think there's kind of a few different layers to that. Like, I think one, owners don't recognize it as readily, right? Like, if a dog's going to have an allergic flare, they're going to slurp their paws next to you.
Yeah.
A cat's going to go hide and all of a sudden have a bald belly. And cats are naturally groomers. So it's really easy for owners to think, well, they're licking their belly, but that's normal because they're groomers. I also think just because we are more limited on what we have available for cats, that, you know, we kind of want to give up on them a little bit easier. Like, well, sorry, that's what I got and that's it. But there's so many simple things that we can try to get these cats more comfortable, and they deserve to be comfortable. You know, we should still be working with our cat clients so that we can provide comfort for these itchy cats.
Do you think we make assumptions about what cat clients are willing to do with their cats?
Totally. I totally think that we make assumptions, and sometimes they're true. But there are clients that are really good about giving medications or doing the things with them.
Start to unpack the toolbox for me a little bit. So we've got allergies in cats. First of all, most common presentations of allergies in cats. What are we talking about? Like, what do you think gets overlooked?
Yeah, I would say that if we think about the most common things, bald belly cats are probably pretty high up there. So they just come in, they're coming in for your wellness exam as a GP, and then you just look at them and start to notice they're kind of thinning on their belly. And again, because they're naturally groomers, owners don't think much of it. We also see a lot of head and neck itchiness. So they'll kind of like really scratch their head and neck, and they'll have excoriations all over. And then, of course, the different representations of eosinophilic granuloma complex, which I think those are kind of tricky because the oral lesions a lot of owners don't look for unless they're actually showing us symptoms. So I always try to encourage vets to try to do oral exams in cats if they're accepting of it, because you'll be surprised what you can find.
Yeah, it's funny. I always do my absolute best to do oral exam on cats. I don't ever think about it as an allergy check, but it makes, I mean, it totally makes sense.
It doesn't have to be crazy things. People think like the weird pictures of like this nasty eosinophilic granuloma we put up, but it's very common just to find like really little rodent ulcers right here. So I'll just, even if they won't let me do full exam, I try to like lift their lips up and just see if there's any like signs of a beginning of a rodent ulcer, because that's going to confirm to me that we probably have some sort of allergy going on.
Just kind of along the front gums. Okay.
Yep.
Yeah. That totally makes sense. Okay, so when you see that, you see the bald belly, you see rodent ulcers, things like that, you've got some idea that we've got some sort of an allergy problem going on. Where do you start to go from there? How do you sort of approach this?
Can I tell you a secret for most dermatologists when we are talking about itchy cats? We are so excited if they just present to us on good quality flea control. That sounds incredibly simple, but I tell you what, I think I diagnosed 3 flea allergic cats last week. So like
Really?
we get them all the time and we'll see kind of, the exam like flea comb, no fleas. And that's our first step because to me, flea allergies are very common in cats, even if they're indoor. I have diagnosed them in indoor cats in Southern California living on a high rise in Los Angeles. Like we see flea allergy fairly commonly. It's called a cat flea, right? Like the flea wants
Yeah.
to be on cats. But ultimately, if they come in already on good isoxazoline flea preventions, well, there's quite a few options in cats now. If they come in on that and they're still showing symptoms, it is just a huge step that I don't have to waste the time and money
Yeah.
and effort into for that initial exam. And that includes everyone in the household. That's the other thing we see is like the itchy cat will be on flea control, but not the other animals in the household. And I have actually had many cases where if we just treat all the other animals, that cat gets better.
How did these cats present? Because actually, I would say, when I look at cats and they have flea allergy stuff, it's always that sort of racing stripe up the back. Not always, but in my mind, it's almost always that racing stripe. The triangle above the tail on the dorsal aspect of the lower back. Is that how these cats are presenting as well, or are you seeing? I'm a little bit perplexed at flea allergy cats showing up at the dermatologist. I guess I'm being honest. I think that's why I'm kind of asking this question.
Yeah, all of the above. So racing stripe for sure. We like to say if a cat's not wearing pants, meaning that they're hairless, like on the caudal thighs, rump, belly. I've had them just do the bald belly. I've had them completely be ripping their entire. I have videos of a case completely obliterating itself in the clinic, just completely hairless. Came in on a flea collar, but not a good quality flea control.
Right.
And then within 2 months, that cat was on nothing but flea prevention and has been completely controlled now for 3 years just on flea prevention. So they really can present in a lot of ways. But yes, a lot of times if they have that racing stripe, if they don't have hair towards the back end, you think of it. But even if you have to remember too, cats like to get more than one allergy. So even if you don't get them fully under control by having them on good flea prevention, as a dermatologist, when I go to work that case up, I just can get that out of my mind that there's even a component of it, right? Like if they're food and flea, if I just know we're on good flea prevention, I've crossed that bridge and we can focus on everything else versus they're both of those, but we keep having to give them steroid injections because we don't control one aspect of their disease.
Right. Okay. That makes sense. So flea medication seems like a great place to start.
Yes. Please. Please, please, please. We do. We see it quite often, which I think surprises a lot of people. But we actually get a ton of flea allergic cats in our clinic. And we feel bad because they have to wait to see us. We're more expensive. And it's something like pretty straightforward.
What else do you like to go to?
Yeah. So then I would say we assume they have good flea control. Then we're starting to think of, to me, kind of 2 things. Like 1, how do we make them comfortable? And then 2, how do we continue to work them up? So there are some important things to realize about feline allergies, one of them being distribution. So there has been a study, a multi-center study that showed if cats tend to scratch towards their head and neck pretty frequently, that they're a bit more likely to have food allergy as an indication of their itchiness. So if they are really exhibiting that kind of head and neck itchiness, then, and I know they're on good flea control, then that's usually my next step. And you have to be really willing to work with clients over, what they'll feed. Can they be strict?
Yeah.
If they have multiple cats, is that possible for them? And so then we kind of dive into that discussion to rule out a food allergic component. Many cats don't have abnormal gastrointestinal signs. So even if they seem to be defecating normally, not really vomiting, they can still be extremely itchy from a food allergy. And so to me, if I can get any cat under control with flea control, indoor food, long term and not have to give them oral medications, I'm very happy for that owner. Then assuming that portion we've got under control and we're going to go down the feline atopic skin syndrome, which if you don't know, that is the official name for environmental allergies in cats, which is kind of long and complicated, but it just is meant to be a representation of how crazy their allergies can present. If you think about environmental allergies in cats, it can be anything from I have a rodent ulcer eating my front lip to I have asthma to I get itchy all over my body. So they just present in so many different ways. Then we're going to work on making them comfortable, but really be trying to drive them to allergy test and do immunotherapy, because that's one of the main ways we can start limiting how many oral medications they can take long term if we can help it.
Jumping back real quick, I have always had the impression, I'll just say, for me, it has been substantially harder to get cat owners to go in a way, I believe, on diet trials than it has been for dog owners. Have you seen that as well? I don't know if it's true or the perception is just, oh, well, she's only going to eat what she wants to eat, or she has this specific food that she demands. I don't tend to get that much pushback. There may be pushback about price or things like that for dogs, but I've had such challenges in getting pet owners to buy in and do a food trial in cats. I'm assuming by the time, if they have someone who's come to the dermatologist, they're probably more open to advice maybe than the general populace. But have you found that to be true at all? And if so, how do you sort of approach that conversation of getting the owners to say, okay, we'll try a different diet, even though Fluffy really loves her Friskies diet?
Yeah. I think there's probably some truth to that. I mean, I certainly have dog owners who are still hesitant, or we get finicky dogs, but we know cats are kind of like little aliens, right? They make the rule book and we're just there to live in their world. So there's a couple tips I do. One, I say, like, what do they like? What do they need? I have my preferences on diets, but there are some limitations, right? Like, Altamino's great, but if they need a wet food, that doesn't have a wet food. So then I need to kind of consider other options of, okay, if we're going to go novel protein, that's fine, but then I have to know what they've been on so I can make sure it's actually novel for them. So I start out by asking, like, what is it your cat does tend to prefer? Do they need a wet? Do they need a stew? Do they need a treat? Are they fine with just kibble? Are there other cats in the household that have nutritional needs, and can you keep them strict? So, if we can, ideally, you just put all the cats in the household on it, but that's not always the case. If we have a cat who has renal disease that we can't ignore just because we're trying to do a diet trial on another cat. So then I just make sure, one, we don't have nutritional needs of another cat we have to consider. And then three, the way that I think I have a decent job, I still get people who won't do it, but a decent job at getting people to do diet trials is I give them the end point. I think we really need to focus on the fact that this is a diagnostic test. If we just say, oh, we're just switching the food, I think people visualize forever, right? They visualize like, oh, well, now I have to buy this really expensive food, and the Friskies is like my love language to the cat, and you're taking that away forever. And I'm like, I'm not. I need 8 weeks. I need 8 weeks, because if Fluffy is no better for this diet change, cool. I can feel comfortable knowing we're not missing something. We move on from food. If we get through 8 weeks and the diet has made a huge difference, that doesn't mean we can't feed anything else the rest of Fluffy's life. We just know what baseline looks like, and then we can kind of add the other fun things back in and see what makes them flare and what doesn't. So I think really giving a finite amount of time is super helpful.
I really like that a lot. It's a much smaller ask to say, we're going to do this for 8 weeks. And 8 weeks is not an substantial amount of time, but it feels like a defined thing that, okay, we're going to do this. So my dog is wearing the Elizabethan collar right now because he got his teeth cleaned, and he got wart taken off of his leg, and he will pull the stitches out immediately if he can. And I feel bad for him. He doesn't understand. He bangs it in. He's that dog that just refuses to acknowledge he's wearing it. So he hits the door frame, and he'll take you out, face that thing into your shins. And the fact that it's going to be 10 days makes it all absolutely doable. If it was kind of like, let's just see if this helps and maybe he'll wear it forever, I would be out. But knowing that we're going to do this, at the end of this time, we will have accomplished something, and that will be over. And so I love your point of, we're going to do this for 8 weeks, and then we're going to know some things, and we will have that information. I think that makes a lot of sense. Hey there, are you a veterinary practice owner? If so, I would love to work with you. Why don't you come to the Uncharted Veterinary Conference Practice Owner Summit in Atlanta? It is December 5th through the 7th, and it's in Atlanta, Georgia. It will be me and the Uncharted team working hands-on with only practice owners, practice managers. So this is going to be a small boutique conference. It's going to be a gathering. We're going to have about 60, 70 practice owners. Everybody there is going to be a practice owner or have been a recently retired practice owner. And we are going to be digging into how to make your business work for you instead of you constantly working so that your business can stay afloat. I know a lot of you are living in that place, in that headspace. I've been there. We're going to get out of there. We're going to make your business serve you, which is something that a lot of us dream of. So we're going to get in there and make it happen. Head over to unchartedvet.com. I'll put links in the show note directly to the event. Learn more about the Practice Owner Summit. You're going to need to become an Uncharted member to come. It is 100% worth it. Anyway, I hope to see you guys there. Talk to me a little bit, Ashley, about comfort of the cats and specifically sort of itch control while this is going on. So we've got this cat and they're coming in and they've got the bald belly, and they've got, evidence of scratching around their neck and things like that. And you say, well, I want to try this diet trial, or, I think this may be feline atopic skin syndrome. And we're going to set you up for some allergy testing with the dermatologist. What are you doing for comfort for these cats while you're doing this? Are you doing anything, or are you concerned that what you do is going to negate the efficacy? You know what I mean? If I do a steroid injection and then send them out to do a diet trial, they go, oh my gosh, she immediately is better. And I go, well, is she better? Or are we riding out this other, medication that I gave, something like that? So help me sort of understand that.
Yeah, I still use a decent amount of steroids in cats, to be honest, because they gets quick relief as long as they're not a contraindication based on their other comorbidities. I don't use a ton of injections, but a lot of that is just because by the time they come to me, they've kind of gone that route, right? Like they're trying to get away from that. They can't really do that as often. So I do tend to use a bit more oral steroids, and I work with owners to kind of get them to take that. But I still think they deserve to be comfortable. You cannot send them out the door saying, here's your bag of food, see you in 8 weeks.
Yeah.
Like they're going to call you in a week and be ticked off.
Sure.
So ultimately, you still need to make them comfortable. When I start a steroid, I'll tell owners, like, if they're great in a couple of days, it's the steroid, not the food. But the way that we figure out if the food is helping is to get them off the steroid eventually. And then a lot of the answers in the challenge, right? Because you're 2 months, it's a long time. You could switch seasons, like a lot of other things can happen. So when owners ask, well, how are we going to know? I'm like, well, no, because we'll try to stop the steroid and we will try to ultimately challenge that diet. I also just want to stress the importance of really only thing we have on label for cats for allergic itch is atopic. And we still use a ton of cyclosporin in cats, and it can work very, very well. I think some things that people forget is that you can use the capsules in cats. So the liquid's on label, and that's what's kind of marketed for cats. But I ask cat owners, like, what's easier for you, a liquid or a capsules? You will be surprised how many cat owners actually will prefer capsules. Now, they're not the smallest capsules in the world, so we have to be honest about that. But the liquid has a bitter taste to it. So if I'm going to utilize cyclosporin, I kind of ask them for a starting point. Like, which one do you think have more success with giving? And if that doesn't work, we can go to the other one.
Yeah. So I really like what you're doing here. The emphasis on the challenge makes a ton of sense to me, because if you say the emphasis is on the elimination part, then that's always the question for me is, well, if I send him home on steroids and then it's springtime and we, very quickly, things flare up. I can't, I'm all snotty and congested for 7 days, 10 days, something like that. And then I kind of move on. You go, well, if it's just the diet trial, I still question, what did we actually learn here? I like the idea that the whole time you're telling them we are going to challenge when we get to the end. I think that's, I like how you stage it and go ahead and set them up for that. I will say I have been guilty in the past of saying, let's try this other diet and we'll do a sort of a diet trial, quote unquote, and let's see how it goes. And then they say, well, it's great. It's working great. And I said, well, let's just go on and not come back and done the trial or the challenge to actually say, oh, yep, when we did challenge, we got this response and now now we know this. And so I like that you set that expectation at the very beginning. When we're talking about sort of comfort and itch control and things like that, if the plan is to do some sort of allergy testing, things like that, talk to me a little bit about what is safe for me to intervene with to sort of provide comfort before we do this allergy testing versus where am I potentially hampering the test?
So that's a really great question and something that's very individual on the dermatologist. So one thing I would suggest is if you have a local dermatologist in your area that you're going to be referring to, checking in with them, I can give you kind of the general synopsis for me. First, if we're going to serum test, so cats notoriously do not pop up their skin tests very well. So it's kind of hit or miss if dermatologists will skin test them. Something that we have been doing and is reported in the literature, but not everyone does, is something called IV fluorescein. So you actually skin test a cat. You have to do it fairly quickly. So you have to have yourself or staff trained in it. And then you actually give a little bit of IV fluorescein through a catheter, and then you read it with a black light and it enhances their positives. And again, not everybody does that, but more and more people are starting to do that. And we've had some pretty good success with that. There are some people that will prefer serum tests just because cats don't tend to, again, pop up their positives like dogs. Like horses are like the best. Dogs are kind of next. And then cats, like, again, they like to be difficult. For a lot of the serum panels, and there's pros and cons to all of them, the steroids and cyclosporin, things like that, don't really have a huge effect on them. So I don't personally get too worried if someone refers me to them and we're just going to serum test for whatever reason. I preferably try to do both. That's an individual preference if finances aren't an issue, just to collect as much info as possible. For my skin test, they can't be on steroids. So they would have to be off of steroids for at least a month, usually is our preference. So if they get a long-acting injection, say like Depo, right, that could actually be a few months because it's in their system for a couple months. So cyclosporin, though, if you are using off-label Apoquel, to our knowledge, there's not a huge impact on skin testing. So steroids and then antihistamines, if you are using an antihistamine, depending on how long they've been on it, most of us say like 1-2 weeks they need to be off of it before we can skin test. There's not a huge impact, though, on serum testing.
There's always been a bit of a question, I think, around serum testing. I think in just, and this is over the last 15 years or so. Overall, you seem to be positive on the benefits of serum testing, and it sounds like, depending on the panel that you choose, results and mileage may vary. When I have pet owners that come to me and asking about serum testing, what kind of general guidance would you give to them as far as efficacy, a worthwhile investment, things like that?
Yeah, so ultimately, if you use some of the more like quality serum panels, first of all, food's not there. So there's some interesting research being done in food, but we never suggest it as like a diagnostic test, so we don't run food panels. But if you're just looking at environmental, the couple things I can tell you is, one, we utilize those results to help us formulate immunotherapy, but it's not, that's a high number, so that's automatically what goes in. You're still supposed to be evaluating like their history, their seasonality, cross-reaction. So there's this weird art form that goes into it. And if you want to start a fight at a derm conference, ask about serum versus skin testing, because there's a lot of opinions and there's a lot that we just honestly are still discovering and don't know, which is why I will try to do both if I can, because I think there can be some different value in both of those tests. But another important thing to realize is please don't allergy test them unless they are committed to immunotherapy, because it's not the cheapest test and we want to be able to utilize that information to help that pet. And if that's not going to be in their wheelhouse, the finances are better off with the symptomatic treatments because allergies are very expensive.
Yeah, that totally makes sense. Help me set expectations around immunotherapy. So if I have a pet owner and they're like, yeah, I would consider immunotherapy. What does that involve? How do you talk to them about what they're getting into?
Yep. So for immunotherapy, I think it's a great option in cats because a lot of cats are actually very accepting of injections, though there is sublingual forms, and I have some cats who do great on that as well. It's just given more often than the injections are long term. I tell owners there's about a 70% success rate, and that's pretty consistent throughout the literature. Now, when I say 70% success rate, that does not mean there's a 70% chance they're just off of everything. But there's a 70% chance we're going to see benefit. So benefit could be, okay, we were even on cyclosporin, and all the things, we're still pretty itchy. And in a year, we need cyclosporin, but now we're actually responding quite well with the addition of immunotherapy. Or I'm a cat who used to break out with pyoderma 7 times a year. Now I really only break out like 1 time a year. So there's a lot of different ways that we kind of judge benefit. I really like to simplify things for owners. So I like to tell owners, if we're going to make this decision to allergy test, that I have A students, B and C students, and F students. An A student is within a year. That's all you really need. And that's our dream for every patient. Like you're off the steroids, you're off the cyclosporin. If you're just immunotherapy and flea control, that would be amazing and very safe. We get a lot of B and C students. And B and C to me is I still need some help, but I am better. So I still need some cyclosporin maybe in the spring, but I am much better than I was when I was not on immunotherapy. We do unfortunately have about 30% of F students. Like we put the time, effort, money into it, and we just don't see any benefit. And that's really hard to ask an owner to commit to something for a year and a half, and there's not a guarantee it'll work. But we do know cats tend to respond really well. They tend to be very accepting of it. And that's one of the only natural therapies we have to truly work with their immune system so they don't keep progressing their disease.
Yeah, well, 30% is not an inconsequential number. I think you're really smart to make sure we're setting these expectations up front at the very beginning of, hey, there's almost a 1 in 3 chance that after a year and a half we're not going to see improvement here. I could see that absolutely being quite frustrating, but at least going in, they have to know it's an option on the table. I think that's just smart communication. Ashley Bourgeois, thank you so much for being here. Where can people find you online? You do great social media stuff. Where should I send them?
Oh, thank you. I am simple. I keep everything under the derm vet. So I'm strongest on Instagram. I also have a weekly podcast that just goes over dermatology information. And then, as you said, I've been enjoying being back on the lecture circuit. So hopefully continuing to do lots of conferences in person.
Thank you so much for being here. And guys, thanks for tuning in and listening. Take care of yourselves, everybody. And that's what we got. Guys, thanks for being here. Thanks to Ashley for being here. If you enjoyed the podcast, share with your friends or leave me an honest review wherever you get your podcasts. It means the world to me. It's how people find the show. So anyway, thanks for that. Take care of yourselves, everybody. I'll talk to you later on.